Hello, my name is Alaina Knapp. I am in Anatomy and Physiology 1, and this is my presentation on the respiratory system. So we're going to start at the top of the respiratory system with the mouth and nasal cavity, then continue down into the trachea, then the lungs, and finally we'll touch on the diaphragm. So here in the nasal cavity, we start with the nose and nostril, which is the opening to the nasal cavity. We then see the nasal meatuses and conchae, which are three stacked nasal meatuses. It's where they're lined with cilia, and they help to trap debris that is coming in from the outside. Then we have the opening of the auditory tube, which links the ear and the throat together. Then we'll talk about the pharynx, which is split into three parts. So superior to inferior, we have the nasopharynx, which is a passageway for air, just there above the soft palate. Then we have the oropharynx, which is a passageway for both food and air. And then we have the laryngeropharynx, and this opens at the inferior end into the trachea and the esophagus. Then we'll look at the bony parts of the respiratory system. So we have the teeth here, we have the hard palate or the roof of the mouth, and then we have the hyoid bone, which connects to many different ligaments to facilitate speech and swallowing. We have here the palatine and lingual tonsils, which are composed of lymphoid tissues. So those help to trap and destroy pathogens entering the body from the respiratory system. We have then also the tongue, and above it the soft palate and uvula, which are continuous. The soft palate is continuous with the hard palate there. Then we have some openings. We have the fauces, which is the opening from the oral cavity into the oropharynx. We have the epiglottis, which is attached there to the thyroid cartilage, which covers the opening of the trachea to prevent food or liquid from entering the trachea when you are swallowing. And then we'll go down into the trachea here. So first we have the larynx, which connects the nasal cavity, or the pharynx to the trachea. Then we have the trachea, which is composed of these ribbed tracheal cartilages, which give it flexibility and bend as you move your head and move your body around. These split at the bottom into the primary bronchi, which go each into the left lung and to the right lung. The left lung is composed of 2 lobes, and the right lung has 3. The left lung also has a cardiac notch to give it room for the heart there. Then these bronchi continue to branch into secondary bronchi, and they get smaller and smaller branches, and then we get down to the smallest branch of the bronchi, which are the terminal bronchiole. So this is the structure where gas exchange is facilitated. So in this diagram here, we can see the terminal bronchiole. We can see the deoxygenated blood, which carries blood from the pulmonary artery, and then that goes and does gas exchange and gets carried back to the circulatory system into the oxygenated blood of the pulmonary artery. So these branch into smaller and smaller capillaries covering each of these alveolar sacs. The alveolar sacs are the smallest parts of the smallest units of the lung are the alveoli, and they help increase the surface area of the so that more and more gas exchange can be facilitated. The alveoli are connected through alveolar pores to help keep pressure equalized through the entire alveolar sacs and throughout the lung. So then at the very bottom, we have this fold of muscle called the diaphragm, and that contracts to expand the rib cage and thoracic cavity to make low pressure in the lungs, which helps you to inhale, and then relaxes to create a smaller space, which creates a higher pressure and then forces you to exhale, driving out waste CO2. So inhaling, bringing in oxygen, exhaling, bringing out CO2, which is the whole purpose of the respiratory system, to help it to get oxygen to the circulatory system and to the rest of your body. Thank you. Have a great day.